Medicam sub-Q, and I'm going to give the reverter here, IM. So in order to give the reverter, I want to make sure that I'm isolating the semimembranosus, semitendinosus muscle. I can feel right there, and that's the belly of the muscle. So I'm going to make sure that I have my bevel up. I'm going to go in, come out, not getting a flashback, and then going in there. I'm going to set this aside for a second and give her Medicam. And come over to your side here. I can give the Medicam sub-Q. So I'm just gonna take her skin here, pull it up, enter into my tent, pull back. Giving it slowly to her. It's in there now. Give the area a little bit of a massage after. Taking both of these right away now. And putting them directly into the sharps. Now we are going to need to get a comb collar for our friend Sadie here. So we need to take a look at her head, see what size I think she'll be. I think she may be a 30, but if not, we'll be a 35. So I want to measure from where her collar is to about where her nose is. See there? It could be a little bit shorter because it's on the top of her head here. That would be fine. We're just going to take the collar off and see whether the collar fits. Now this collar isn't going to fit into our loops here. So here's what we can do. We can put this collar back on. Can you just lift her head? Perfect. And then what we're going to do is we're going to just grab some gauze. So this is a temporary situation. This is not something that we want to leave on the dog long term, the gauze, but we just want to let the owner know that they should get a smaller collar at home for Sadie. And we can lift her head there again. And we're just going to put this through. Be very careful and aware of her eyes. And careful and aware of the incision site. We want to make sure that we're not rubbing this on the incision. And that her ear goes in there. So just like that. So we wanted to be careful that we were not rubbing the incision as we were going in. Unfortunately, we did rub it a little bit as we went in. So what we're going to do is we're just going to take a little bit more gauze. We'll just press the gauze here and we'll make sure that we clean up. There we go, that's looking a little bit better. So what we're going to have to tell the owner is that Sadie needs to be a little bit careful around stairs today because she was given butorphanol and dexvedidine being a sedative, so that even though we've given her a reversal here, we only give her a half reversal. So that way she's going to have a peaceful and calm recovery. So we want to make sure that they're really watching her around the stairs so she can't injure herself, that they're taking her down at the hospital ramp while she's leaving today. The butorphanol lasts about 1 to 2 hours, as we know here, so we gave an injection of Medicam. As you saw, this is a very small lump area or abscess area, so we didn't have to give too much pain medication, but the Medicam will cover her for 24 hours. So we've got her covered for pain, we've got her covered for sedative, and they just need to be watching her at home, making sure that she's not scratching at it, not opening the site, which is the purpose of this cone here. She needs to keep this cone on, and the cone needs to stay on unless she's eating. She should still be offered food at home, but when she's not eating, the cone should be on. Cone can come off when she's eating and drinking, but otherwise it should stay on. The owners also need to be aware that she shouldn't be rubbing her head on anything, and that she should try and stay calm for the next several days at home. But other than that, the only thing we need to do is have the appointment scheduled with the owner for her to come back in about 10 to 14 days, ideally around 12, so that we're able to take these sutures out. The incisions will feel a lot better there now. So we're just going to work on cleaning up our area a little bit more. I'm going to start soaking my tools over there once I've got my patient recovering comfortably in the kennel, but at this point we're gonna just watch our patient and monitor our patient. Again, patient is a priority here. So, you okay to stay with you for a second?
Mm-hmm.
Since we just completed the surgery here, even though it was a short surgery, we want to make sure that she has a good temperature. So we're just going to check her temp. Temperature is perfectly normal. It is 38.8 there today. So it's well within the normal range. We just need to clean this up. I'm going to take a little bit more peroxide and just disinfect here. And then I can put it back into the germostat, back into the exam room here. It's very important that we monitor her body temperature because she's not able to do that herself at this point. So right now she is of good temperature, but it certainly couldn't hurt for us to just have another little blanket onto her here, keeping our patient nice and warm. Now we're just going to wait for her to wake up a little bit more, and then we'll take the catheter out. In the meantime though, we can put her back into her recovery kennel, but when she's going back into the recovery kennel, we cannot leave her in there by herself with the door closed until she's able to stay in sternal recumbency and be able to lift her head by herself. So in the meantime, we're going to have to add a blanket in there, making sure that she's nice and warm. Dr. White will stay with her. And now we want to make sure that we're on the same side of her as we're moving her. Okay. Ready? Make sure you're taking good caution of her head there. So, important that the rear end goes in first. Being gentle with the patient. You can grab the rear end and adjust a little bit back there, Dr. White. Fantastic. And she's snuggling in all these blankets, which is great. Want to make sure that we keep her warm. But she's not ready to be left alone. At this point, we need to make sure that we are making, that she has nothing blocking her airway. She has a palpebral response. So that's great. We're just going to take her head here and prop it up a little bit more for her, making sure that she's super comfortable there. Hi, Sadie. And I'll just stay with her while she's waking up. Hi, Sadie.